The peripheral nervous system of the human body connects the brain and spinal cord to the rest of the body. This includes arms and hands, legs and feet, face and mouth, and internal organs. These nerves deliver signals about physical sensation back to the brain and make sure that the body's internal functions like food digestion and blood circulation work as they should. Neuropathy is dysfunction or damage of one or more nerves that typically results in numbness, muscle weakness, and pain in the affected area. Most of the time, neuropathies start in the hands and feet, but they can affect other parts of the body too. Neuropathy is also called peripheral neuropathy, which indicates a problem with the peripheral nervous system. Nerve damage is more common in people than we think. According to one study, it's estimated that more than 25% of Americans have neuropathy. It affects people of all ages, but it's more common in older people. Around 60 to 70% of people with diabetes have some nerve damage. Another common cause of injury to the nerve is physical trauma. This includes fractures, car accidents, or falls. Other possible neuropathy causes include alcohol consumption, autoimmune disease, and infection. Treatment options for nerve damage depend upon the underlying cause. In today's video, we'll discuss in detail about the top 10 signs that your nerves have been damaged. Number 1. Numbness. One of the most common symptoms of nerve damage is numbness. It involves a reduced or complete loss of sensation in the affected area. This absence of feeling can range from mild to severe. Numbness is an essential indicator of nerve damage and can affect various body parts, including the hands, feet, or other extremities. It's crucial to address numbness promptly, as it may signify an underlying medical condition that requires diagnosis and treatment to prevent further complications. Number 2. Tingling or paresthesia. Tingling, or the sensation commonly referred to as pins and needles, is a prevalent symptom associated with nerve damage. It manifests as an uncomfortable prickling feeling in the affected area and is often described as if tiny pins are poking the skin. Tingling nerve damage can occur due to various causes, including compression of nerves, injury, or conditions like diabetes. When nerves are damaged, their ability to transmit signals to the brain is compromised, leading to abnormal sensations. These sensations may be episodic or chronic and can affect different body parts, such as the hands, feet, or limbs, depending on the underlying cause of the nerve damage. Addressing the root cause and seeking medical evaluation is essential for effectively managing this symptom. Number 3. Radiating pain. Radiating pain is a distinctive and often excruciating symptom that frequently accompanies nerve damage. This type of pain is characterized by its ability to extend or radiate from the source of the nerve damage to other parts of the body. It's often described as a shooting or burning sensation that travels along the affected nerve pathways. The intensity of radiating pain can vary from mild discomfort to severe agony, and it's a result of the damaged nerves sending erratic pain signals to the brain. Conditions like sciatica, which involve compression or irritation of the sciatic nerve, can radiate pain down the leg. Number 4. Vertigo. Vertigo is a distressing symptom associated with nerve damage, mainly involving the vestibular nerves responsible for balance and spatial orientation. This condition leads to a false sensation of spinning or a feeling that the surrounding environment is moving when in fact it is not. Nerve damage affecting the vestibular system can disrupt the intricate balance signals sent to the brain, resulting in vertigo. This symptom can be debilitating, causing dizziness, nausea, and an unsteady feeling. Managing vertigo in cases of nerve damage often involves addressing the underlying cause, such as inner ear issues or neurological conditions. It may include treatments like vestibular rehabilitation, therapy, medications, or lifestyle adjustments to mitigate its impact on daily life. Number 5. Burning sensation. Another frequently reported symptom of nerve damage is a burning sensation, and it can be attributed to various underlying causes. Nerve damage or neuropathy disrupts the normal functioning of nerves, leading to abnormal sensations like burning, tingling, or pain. One common cause of this burning sensation is peripheral neuropathy, often associated with conditions like diabetes, where prolonged high blood sugar levels can damage nerve fibers. Another potential cause is nerve compression or injury, such as in car accidents or falls, which can result in nerve damage and the subsequent burning feeling. Additionally, autoimmune diseases and infections can lead to neuropathy and the accompanying burning sensation. Accurate diagnosis and timely treatment are crucial to address the root cause of the nerve damage and alleviate the discomfort associated with the burning sensation. Number 6. Tremors. Tremors, involuntary shaking, or rhythmic movements can result from nerve damage with diverse underlying causes. Conditions like peripheral neuropathy, often associated with diabetes, can damage the motor nerves that control muscle movements and lead to tremors. Autoimmune disorders such as multiple sclerosis can trigger tremors when the immune system attacks nerves. Neurological conditions like Parkinson's disease also involve nerve damage and are known to cause tremors. Number 7. Oversweating. Excessive sweating or hyperhidrosis can be a symptom of nerve damage. Conditions like autonomic neuropathy or diabetes-related nerve damage disrupt the body's ability to regulate sweat production, leading to overactive sweating. Number 8. Arrhythmia. Arrhythmia, characterized by irregular heartbeats or heart palpitations, can be associated with nerve damage and has various potential causes. A complex network of nerves regulates the heart's rhythm, and when these nerves are damaged, it can disrupt the regular heartbeat. One common cause of arrhythmia in cases of nerve damage is autonomic neuropathy, which affects the nerves responsible for controlling involuntary bodily functions, including the heart rate. Additionally, certain heart conditions such as myocardial infarction or heart attack can result in nerve damage and subsequent arrhythmias. Number 9. Dribbling urine. Dribbling urine, a condition characterized by the unintentional loss of urine after using the restroom, can be linked to nerve damage and has multiple potential causes. Nerves are crucial in controlling the muscles responsible for maintaining urinary continence. When nerve damage occurs, such as peripheral neuropathy, the communication between the nervous system and the bladder muscles may become disrupted, resulting in difficulties controlling urine flow. Additionally, conditions like diabetes can lead to nerve damage that affects the bladder's function, contributing to urinary dribbling. Accurate diagnosis and tailored treatments, which may include medications and pelvic floor exercises, are essential to address the underlying causes of urinary dribbling related to nerve damage effectively. Number 10. Pausing breath during sleep. Pausing of breath during sleep, known as sleep apnea, can be associated with nerve damage and has various potential causes. Nerves play a crucial role in controlling the muscles involved in breathing, and when these nerves are affected, they can disrupt the standard breathing patterns during sleep. Conditions such as diabetic neuropathy can lead to nerve damage and increase the risk of obstructive sleep apnea. Additionally, certain neurological disorders can impact the brain's control over respiratory muscles, contributing to central sleep apnea. Want to know what are the best vitamins to reverse nerve damage? Watch our video on the top 10 best vitamins for your nerves that can heal neuropathy. Remember, this video is for educational purposes. We are not giving you medical advice. You should always consult your doctor if you need any professional opinion. Did you find this video helpful? If yes, then make sure to like this video, subscribe to our channel, and hit the bell icon to view more upcoming Create Cure content like this.